All right, so welcome back to your third visit. You should have got adjusted and treated on your last visit. If you were sore at all, don't panic, it's okay. Sometimes people feel sore, just like when you go to the gym for the first time and you work out, you can feel sore after. Doesn't mean the gym hurt you. It doesn't mean the gym was bad. It just means you weren't used to that, so sometimes you can be sore. So today we're going to do another treatment with you because next time we're going to be predicting what we think you need, and we need to see how your rate of response is going to be based on these last couple visits. So in front of you, you should have a chart. Looks like this. If you want to go ahead and pull that out so we can go through that. Usually people, when they come in, often they've been to a chiropractor or they know about it. My first question always is, hey, that's fantastic. What kind of care did you do? And doing this for many years, I've never had anybody answer that correctly. People say, I did chiropractic care, and they don't even know there's different types of care. The three main types are relief care, corrective care, and preventative care. They have different goals and they have different purposes. So you need to know what you're picking in order to have the right expectations for the results that you want. When you look at this chart, most people will come in down at the bottom in the red there where it says obvious symptoms. Obvious symptoms is where you do not want to be. Unfortunately, that's where most people are when they come in. Where you want to be is way down at the other end where it's green in the maintenance and prevention. In order to get there, we need to move you all along that chart up to that point. One of the key points that people tend to blow is they'll start moving up that chart and they'll hit that symptoms gone phase. And what do you think a lot of people do that don't understand when they hit symptoms gone? Yeah, they quit coming in because they think they're all better. The problem is if you didn't change the muscles and tissues, specifically the deep stabilizer muscles, what do you think is going to happen to that person's problem the next time they go do something in life, or they do sit at their desk, they slip, they fall, whatever? What do you think is going to happen when they're so close to the edge there when they have that accident or injury? Right, they're going to flare up. So then they go back into obvious symptoms. And then they go to the chiropractor again, and they get worked on. And then as soon as they feel better, they quit. And then they're hurt again. And they end up in a relief care cycle where they're going round and round and round, never really getting to the root of the problem. And that tends to allow things to just continuously keep getting worse. Now, you can argue, hey, that's better than taking drugs. And yeah, it probably is, but there's even better than that. Wouldn't it be better to just get way up into there where your function's high? So you have to get those muscles and tissues changing. So if you look at your chart, it says soft tissue reconstruction, muscle ligament strengthening, spinal stabilization. That means strengthening all those tissues and having them working well so that you don't have problems and you're less susceptible. Once you're up in that part, that's where things are working great, and it's easy to keep it working good from there. The sad part is people don't know, well, how do I know where I am? I mean, how are you going to know where you are? And again, that goes back to the testing we did with you on that first visit. The testing will show you what your level of function is so that we know what you need and you know what you need as well. So when you're looking at these muscles and tissues, it's kind of hard to understand sometimes, but think of it like this. If you were to take a bar or something and hit my arm right here and hit my biceps, that muscle would become injured. As that muscle got injured, it would spasm and contract and tighten. My arm would then contract and pull up, and I would hold it like this and go, oh, I hurt my arm, right? If I tried to open my arm, it would feel worse, so I would keep it like this, and I would baby it and just keep it like that. And if I did that for a long time, months, years, I wouldn't have use of my arm. It would not work. And if you said to me, hey, Dr. Mike, your arm doesn't work, and I said, oh, don't worry, it doesn't hurt. Its function's poor, but it doesn't hurt. It would still be a problem because I don't have the function, so I can't do stuff. So you would need to get my function back in my arm. And how would we do that? If we just said, hey, we'll just straighten your arm out, and you grabbed my arm and you just pulled on that to strengthen it or to straighten it out, I probably would not like that. And as soon as you let go, what would my arm do? It would pull right back to how it was. If I did it again, it would pull back. If I did it again, it would pull back. If I did it again, it would pull back, right? If we did that frequently enough, say 3 times a week, we would have, probably in a handful of months, we would have my arm straightened out and it would all be working fantastic again. And this is very similar to what we're doing with the muscles in your back. We have to, number one, get them to relax and then stop pulling back, which means we have to work on them frequently enough that they're actually going to change. So it's similar to going to the gym or working out. You have to do it enough or you see no muscle and tissue changes. So when you go to the gym, how often do they recommend that you go? 3 times a week, right? That's how you get results. So what are we recommending? 3 times a week, but that's why. You're gonna change the muscles that way. It gives you your best odds of success. So does that mean 3 times a week forever? Of course not. So how would you know when you didn't need 3 times a week anymore? The tests. If you can do all the tests, or you can do a majority of them, or maybe there's some tests you'll never be able to do, but we see you reach a plateau, then we know that we can cut back and just try to maintain that. So 3 times a week until you reach a plateau on your testing, then we can cut back and do as little as possible to try to just maintain where you are and prevent problems. All right, so the question always is, how are you gonna know where you're at? And like we've been talking about, it's by retesting you. And typically about every 12 visits, we retest you so we can see where you are, so we even know what to recommend that you need. This chart, you should have a copy of this so you can see it, but this is how we actually keep track of where you are. And what happens is about every 12 visits, we're gonna retest you so that we can actually then watch and see where you are based on your testing. We can then create a graph and be able to graph your progress on that chart so you can see if you're at 20% improvement, 30, 40, 50, 60, wherever that may be. That way we know what to recommend for you, but you also are going to be able to make an informed choice about where you want to be on that graph as well. So on this graph, when you look at your progress, as you start to move up, when you hit about that 40% line, guess how most people feel? Yeah, they feel pretty good. Think about it from a testing perspective. If we got you to 40%, but we then left 60% of the tests that you failed in your body, what do you think would happen if we just stopped right there? Obviously, it would come crashing back, and that would be a big problem. So it's better to try to bring your testing up as high as you can and get up into the 60s, 70s, 80s, 90s, as high as you can to that 100%, so that you have the least chance of having another flare-up or a problem, and you have the greatest chance of lasting as long as possible with function so that you can be older and still moving and doing the things you want to do. Now that you have a good understanding on how this works and how the testing works and the retesting so we can actually track your progress, go ahead and head up to the front and they're going to find a time where we can get you back in here so that we can go through estimates with you. Have a great day.